Reminded that we still have the Kai Tak cruise terminal crossing, but this is not a regular border crossing as such. It's only open when there is a cruise berth there. I understand that people are concerned about the transportation of goods and daily necessities. There are some worries and anxieties, and there are people trying to mass purchase such stocks. And also at Mankamto and Shuttlecock, the temporary arrangements will not affect freight transport. We're talking about the shutting down of passenger or the road traffic crossings for the passengers. If you see that there are empty shelves in supermarkets, it's because of the logistics problem. It's not because of the supply of the goods. We have maintained very good communication with suppliers. There's no shortage. I hope the people of Hong Kong can be assured by such a message. Let me say something else now. It's about the hospital authority and its services. Yesterday, some of HA employees went on industrial action. HA provides services to the people of Hong Kong, and yesterday such services were affected, especially in certain hospitals for ICU for the newborn babies and cardiological services and isolated wards, and also the A&E wards, and also for some the oncology services, angioplasty operations and radiology services. They are affected to varying degrees. And those patients affected, some of them are critical. Some of them are in urgent need of such services. So the industrial action affected these people of Hong Kong. And what is more saddening is that for the post-natal pediatric ICU, it's a neonatal ICU for newborn babies. They need special care by specialists. Since some of the HA employees did not turn up for work, and therefore HA had to cut down on non-emergency or outpatient services. And those who are those who are on duty face, therefore, a greater workload. Healthcare workers are supposed to be professional and compassionate, and I must say I appreciate those who insist on carrying out their duties yesterday. And since there's a manpower shortage faced by the HA yesterday, some private healthcare professionals have indicated wishes to work for the HA. I appreciate their goodwill, but as the chief executive of the HA has said, although these are trained professionals and healthcare workers, taking them on board on such a basis may be difficult, but still they have shown their willingness to help Hong Kong in such a difficult time, and I must show my appreciation for their spirit. Some of them were subject to the doxing threats after they have expressed such a wish to help the HA on social media. We always put the care of patients first. In this difficult campaign to fight against the virus infections, most healthcare workers in the HA have been very diligent in carrying out their duties. The SAR government also attached the highest importance to their needs. As I've said many times, and I have undertaken to the HA chairman and HA chief executive that I would give first priority to their needs in terms of medical supply and equipment. I've told the HA that in this exercise, financial resources will never be a problem as long as they can let us know that they need something. We would certainly do our best to do it. And we would also source such materials through the global supply chain and provide them to our healthcare workers as a matter of priority, and which also improve the supply of equipment to clinics and wards concerned. We understand that people also have concern about supply. Hong Kong is a very densely populated city. It's difficult to find so suitable locations for isolation facilities. But we have to let the people know that this is important to offer protection and to prevent the spread of the virus in the community. Another way to protect our healthcare workers is to do what Professor Yuen Kwok Yung has said, and that is for suspected cases and or confirmed cases as well. The patients might have concealed their travel history. That posed a threat to our people. Therefore, to beef up the support in this regard, within this week, we are going to set up an electronic system so that HA staff can quickly access information on whether the patient had a recent travel history outside Hong Kong. This is what we can do to lessen the workload of healthcare workers and to respond to their needs in handling such cases. The SAR government would implement this system expeditiously. We hope that this will be supported and welcomed by the healthcare workers concerned. Over the years, because of the workload problem and the lack of sufficient facilities, the HA has been trying various ways to improve things, such as investing $200 billion in the program to build more hospitals, to cope with population increase and demographic changes, such as the aging of our population. Such efforts will continue. So in relation to the current problem as well as the long-standing ones, the SAR government and the HA will work hand in hand to improve things. Once again, I appeal to all healthcare workers to attend to their duties faithfully, and I hope those who have done otherwise would change their mind. I'll now take questions.
So the reporter, please state your organization.